Hello, my name is Dr. Tran with TriCare Chiropractic, and today this video I also want to share to you guys how to measure your blood pressure correctly at home. So first and foremost, you don't want basically wearing a jacket in your long sleeve shirts or sweater because you want the cuff to touch the skin directly. Ideally, when you're sitting, you want to sit with both feet on the floor and somewhere in the back support where you can basically just sit all the way back. And then the most important thing where there's a lot of people have inaccurate reading is the cuff. The cuff is either too small or the cuff is either too big. Ideally, you want a cuff that fits snugly. So buy the one that has the correct size for your elbow. And basically, as you can clearly see, this is the one that measures the brachial artery, which is right here on the crest of your elbow. So I prefer for you to purchase this kind versus the kind that at the wrist area is not very accurate. So what I'm doing right now is I'm placing it on my elbow, my brachial artery. You see where that wire is at? You want to be on top and basically just try to tighten it up comfortably. And I'm going to check the blood pressure right now. As you can clearly see, that's my blood pressure. My blood pressure, the first number is 134, the second number is 88, and my pulse and heart rate is at 82. Yes, this is not a good number for myself also as well, but for me, I know my blood pressure. Normally my blood pressure doesn't run this high. It's possibly just basically trying to get ready for this video, a little bit of anxiousness, a little bit, and also I'm talking. Instead of ideally what you want to do when you check your blood pressure at home, you want it to rest for about 5 or 10 minutes first, and then sit up and basically get your blood pressure checked. It's important that you're not talking. It's also important that you're in a quiet room, so basically you can be very relaxed, and that's the best way to give you the most accurate blood pressure reading. So as you can clearly see, while I'm sitting, you gotta sit up straight, and you see how my cuff is at? My cuff is fit snugly, and it's also at the level of my heart. That's the key. If I measure my blood pressure like this, it would be very inaccurate. It would be very high. So ideally, you want something where you can place your elbow and the cuff is basically lined up with your heart. The cuff size is very important. If it's too loose, if it's too small, it's going to give you inaccurate reading. So what does those numbers mean? The first number is called the systolic number. It's the amount of pressure basically in the arteries when the heart contracts or the heart beats. And then the second number is referring to is the amount of pressure in your artery when the heart relaxes. So that's your diastolic number. Ideally, even for my age, we should be aiming for 120 over 80, ideally too. So that's a good number for us to try to reach. Versus the bottom, the third number is referred to as your pulse or your heart rate. What that number is, the number of beats per minute. So ideally, the range you want to be is between 60 and 90. If it's below 60, it's not good. It's referred to as bradycardia. If it's above 100 or more, it's referred as tachycardia. And we don't want it to be so high also as well. So when it comes to blood pressure reading, it can change every 5 minutes, as you can clearly see. So ideally, you want it to rest. You don't want to talk while you're getting your blood pressure checked. Also, if your bladder is full, you wanted to go to the bathroom and empty your bladder before you check the blood pressure. And also at the same time, when you're anxious or when you're stressed out or when you worry, your blood pressure is going to be a lot higher. For example, like in the morning, when you check your blood pressure in the morning, it's normally going to be a lot higher because of your cortisol level is a little bit higher in the morning because of your circadian rhythm, which is your biological clock. And at nighttime, it's usually a lot lower. Also, we have a lot of patients that they keep on telling me that when they go to their doctor, their blood pressure reading is very high too also as well. Well, there's a terminology for that. That's referred to as the white coat hypertension. Like I say, it's because probably you were nervous while the doctor is checking your blood pressure, where the nurse is checking your blood pressure, or just go into the office, knowing that you go into the doctor offices, there may be traffic, you may have a hard time finding the parking, or you may go inside into the doctor's offices and wait for about 30 or 40 minutes. You get frustrated, so therefore a lot of emotional goes there. So when you get your blood pressure checked, it's usually is high. So therefore, getting your blood pressure checked at the doctor's office is not very accurate. That's why it's so important for for us to buy one of this at home. It's very affordable. At Walmart, you can get this system for $30. Just make sure to get the one with the elbow cuff, not at the wrist cuff. Hopefully this helped. See you next video.